Thank you for coming in today, Mr. Engel. So, as you know, we've had a couple of appointments already where we've been going over some exams, and we are going to discuss your findings today and go over a care plan that I've curated, all right?
Okay.
So, your plaque score came back to 3.5, which is generally considered poor, and your bleeding score is 62%. So, that's where, when we went through that probing and we found all those little bleeding spots, it all accumulated to be about 62%. And when we were going through a periodontal assessment, we've noted some generalized red tissue where it's like a little angry looking. And there was some slight gingival recession on your maxillary and mandibular canines and premolars, which, if you look here, are these teeth right here on both sides. Okay? And we also found 3 carious lesions, which are cavities, on the occlusal surfaces of your molars, specifically number 3, 14, and 19. And those ones are 3, 14, and 19. So, and all of this accumulated together, and we have found that you have slight periodontitis. Sorry, I got tongue tied there for a second. So, over the course of the next 6 months, we're going to try and get rid of the periodontitis and get down your plaque and your bleeding score. So, our long-term goals are to decrease and maintain the plaque score to 0.5 or less by the end of April next year. Halt the progression of periodontal diseases by reducing the bleeding score to 0%, again by next year, and then have the carious lesions, cavities, restored by the end of April next year. We'll focus more on the periodontal disease and the carious lesions on some other appointments. For today, though, we are going to mainly go over plaque and have an understanding of what plaque is and have you be able to define it by the end of the day, and demonstrate the proper brushing techniques by the end of the day as well. Also, something to look forward to and work on, that we're going to work on by next week, is decreasing that plaque score by 1% or more. So it's 3.5 now. When we see you next week on the 15th, we're going to try and have that down to a 2.5, okay? All right, so let's get started. We're going to start with plaque, all right? Can you tell me in your own words, what is plaque?
Is it like from buildup from food?
That's a common misconception. Plaque is a multi-species bacterial biofilm deposit that is soft and sticky. You know, like you ever like run your tongue over your teeth and it's like, got that tacky feel to it. That's what plaque is. In its early stages, it's translucent. The longer it stays on your teeth, the cloudier it gets. It can also be stained, like you were talking about how you like Dr. Pepper and those iced caramel lattes. If left on your teeth, they can start turning it like a brownish yellowish color, you know? So, how does it form?
From not brushing your teeth?
Yeah, no, that's exactly right. If you don't brush your teeth, it can start accumulating a bunch of microorganisms, a lot of bacteria, you know? So where does it form, where does it stick, and how often does it form?
I guess like on your teeth, and probably like daily.
Yeah. Yep, no, that's exactly it. So like as you can see here in this picture, see on that gum line, that like thick yellow sticky looking stuff? That's plaque. It can also form on your tongue. And it can start forming 4 to 12 hours after you brush your teeth. So like as soon as you put that toothbrush back in its holder and you go on about your day, even if you don't eat or drink anything, which I would recommend, but in the case that you didn't, that plaque would still form. And if left undisturbed for 3 days, it can mature. Okay?
Okay.
All right, and how is plaque removed and how often should it be removed?
By brushing your teeth.
Yeah.
And I mean, I guess since you said 4 to 12 hours, I guess brushing your teeth every 12 hours.
Yeah. No, that's exactly right. So plaque can be removed by toothbrushing and also the interdental cleaning. So coming to your cleaning visits with us every 6 months. And then toothbrushing, like you said, every 12 hours, twice a day, when you wake up and when you go to bed. All right? So now that we've gone over it, can you tell me what stuck out to you today? What did you learn?
That plaque isn't just food, but it's actually a biofilm that can develop on your teeth every 4 to 12 hours. It matures after 3 days, and that the way you remove, and it can develop not only on your teeth but on your tongue. And it can be removed by brushing your teeth twice daily, and um, yeah, I think that's it.
Yeah, no, that's really, really good, and I'm glad that you were able to take in so much of that information. All right, so now that we have that understanding of what plaque is, we're going to move into toothbrushing and how to get rid of that plaque. Okay?
Okay.
Awesome.